What is circadian clock of the 12 meridian? It is really important to understanding of the organ's function, and also it used many time in treatment method or selecting point. So please take a look this picture. There's a long channel which is starts from the 12 meridian, and anyway it starts from the 3 to 5 a.m. and after 2 hours later there's a large intestine which is 5 to 7 a.m. and 7 to 9, 9 to 11. Like this way, each meridian charges to 2 hours. It means the lungs energy usually getting maximized between 3 to 5 a.m. At that time, the exactly opposite area is the afternoon 3 to 5 a.m. which is the p.m. which is urinary bladder. So these two is faced each other. It's like the sun and moon. Think about that. The sun energy is getting maximized. In the same time, the moonlight or moon energy will be minimized. Or the other way, the moonlight getting maximized, the sunlight will be minimized. Same as like this way. The lung energy getting maximized, there will be the minimize of the UV channels energy. Okay. There's a many doctor uses this diagram for the point in treatment or selection of the point. For example, there's a 4 commander points. Among the 4 commander points, there's a lung 7. Lung 7's indication is good for the headache, or it is good for nape pain. Actually, nape, which is the back of the neck, reasons pain that actually related with the UV channel. So UV channel's condition can control by lung channel. The lung channel, which is lung 7, is really good for UV condition. And also there's the tongue acupuncture technique. We quite often use the point on the terminal eminence area points with Sun Zhongzha. Both are located in this area. But this area points is really good for the neck and nape stiffness, because this area of the lung channel that goes to this area. But when you think about the energy level, this looks like the head regions, and this looks like upper body trunk, and this part is lower body part. So think about that way. The wrist area will be the corresponding to or matching with the neck region. Anyway, so that's why lung 7 is really good for the neck and nape pain, which is a UV channel problem. And also there's an extra point, the tongue acupuncture point, also good for the neck and nape pain, because this area is a muscle area. So when you think about the back side of the neck, which is a trapezius or the trapezius muscle located, and that is a muscle area. So in treatment, in point selection, if the disease is located at the skin layer, you must select the point on the skin part or insert needle on the skin layer. And also, if this is located in the blood vessel, you have to choose the point near the blood vessel area. Okay, and same way, the muscle area points, the muscular pain in the neck region, we can also choose the point on the lung area, especially muscular region. So this area is really good for neck pain. Okay, also lung 7 is good for the neck problem, which is bending problem of the neck. We quite often use the lung 7. And there's another option. There's another thing with lungs low connect. And this is lungs low connecting points. The lung low connecting channel has pathological manifestation, certain something with heat sensation in the palm and wrist. And also another one is there's a UV channel problem, such as enuresis or the frequent urination. All these are in the the lungs low connecting channels pathological manifestation, which is controlled by lung 7. Okay, it is good example lung and UV how related. Okay, And also lungs, the UV, the UV's condition, which think about this way. I use it like a bandage at here, which is the stuffiness of the nose. And also there's two color I use it. The one is blue color, which is runny nose, and also there's a red color, which is epistaxis, the nose bleeding, and runny nose. These are sign and symptom of the what? The lungs the UV's low connecting pathological manifestation. This is another good example. Nose is what? Offshoot of the lung, but it appeared in the UV channel. The points, which is UV 58, which is the low point. Low point of the UV, it treats the nose problem or the lung-related problem. And another one is there's a large intestine kidney. We know that the early or daybreak diarrhea, from the what? Kidney yang deficiency. So we use it what? Xishan1, which is good for what? The tonified spleen and kidney yang in simultaneously and also stops diarrhea. Okay. When look at this, why the kidney yang deficiency cause of the daybreak diarrhea? So kidney and large intestine exactly matching together. The earliest I mentioned, if large intestine energy getting maximized, vision getting minimized, the kidney channel's energy will be minimized. In this reason, if someone has the very small the fire in kidney, like a candle fire. So he only got this amount of the kidney yang energy carries in his body. What's going on? Especially 5 to 7 a.m. Large intestine try to maximize. At that time, kidney energy will be getting minimized. But kidney, there's not enough of the energy inside of the kidney. So kidney try to protect of this weak yang energy from the large intestine qi invading. So the body try to disconnect between the large intestine and kidney by something, vision. The body eliminate everything from the intestines and then save the kidney energy. It means if there's nothing remaining inside of the large intestine, there's no reason to energy levels raise up. Because the energy level raise up, that means the large intestine procedure is main function, which is excretion and also absorption of the body fluid. But at that time, if body eliminate all stools from the intestine, what's going on? The kidney energy will be saved because this energy may not gives to or transfer to the large intestine. So that's why most of the diarrhea happened. The diarrhea appeared between the 5 to 7 a.m. That means kidney yang get weak or kidney yang deficiency. And also there's another option, which is stomach and pericardium. And stomach is, we quite often use it the several point for the stomach problem, especially pericardium 6 and also what else? The stomach 36 and REN 12 or central vessel 12. These 2 point selection is easy to understand, but most of the book explain the use of the pericardium 6 because this is the in-linking channel. In-linking channels, the low connecting point or master point. The pericardium is low connecting, but in-linking master point. But in-linking's indication is what? As memory, the heart, stomach, and chest. So that's why the pericardium 6 can be used for the stomach problem. But this explanation is very weak to explain the full thing. So you can understand this way. If stomach has problem, the pericardium is to control of the stomach as like what? This combination. And then we quite often use it the stomach point on the stomach problem. We use it the pericardium 6 because that reason. Okay, and reverse of the large intestine and kidney. Back to the large intestine kidney. I forgot skipped the one thing. Then please take a look at the large intestine loop connecting the pathological manifestation. And this large intestine channel, which is large intestine 6. The 6 goes to 6, and also and this area. So 6 goes to 6. Just memorize like this way. And large intestine channel pathological manifestation. There's a diaphragm. Anyway, it passes the diaphragm, and also it goes to the diaphragm and also goes to the teeth and ear. So anyway, the large intestine loop connecting pathological manifestation is deafness or cold sensation in the teeth or toothache. This is a manifestation of the large intestine loop connecting channel. So all these are, according to junk food theory, the teeth problem or ear problem, they're more related with what? Kidney. So this is a large intestine weakness that or large intestine problem that easily transfer to the kidney, and kidney get the problem, such as cold sensation of the teeth and toothache or deafness. I use the blue color, which indicate cold. So you can memorize like that way. The large intestine 6 is good for the what? This problem. Okay, and also it is good for what? The chest and diaphragm distension or stuffiness. So this is what large intestine loop connecting problem. And also there's many things which is related with the spleen. Spleen also good for the what? Spleen is good for the transportation and transformation, especially it has an important role to the circulation of the water in the body. So spleen and matching with the face to the senza. So senza problem, which is water passage. So water passage has a problem, easily create the what? Internal dampness. And also heart. Heart, there's a bitter taste. And also bitter taste is usually heart condition. And also we know that there's a frighten or some scaring that has what? The death from the gallbladder deficiency, which is cause of the palpitation, right? So that is a heart problem too. And small intestine chi knotted. This is actually related with the liver, and also liver channel coldness is cause of the what? Hernia. Actually, in Western view, the herniation that is perhaps the part of the what? Small intestine. Kind of this way, all this point, all this channel theory is really important in treatment of the disease or understanding of the point selection in the treatment. Anyway, so I said I explained this channel theory also can be used for the treatment directly, right? For example, if you have pain in the spleen 5 area, which is the ankle region of the spleen area, we can use it at many points, but you can use it the senza area, which is senza 4, which is exactly matching with the joint region of the spleen 5. So it also can be used. So there's many methods. We can use it with long 9, or there's a opposite way, the which one? The spleen condition. We can use it with the small intestine, the joint area point, with the small intestine 5 also can be used for the spleen problem, because there's another theory with Taiyang channel problem. It matching with the Taiyin directly. And also Yangming problem, we can use it with Juyin. And also there's a Shaoyang problem, you can use it with Shaoyin directly. So these are the matching with the channel theory, but another one, we also can be used at the timetable. So if you have any part of the point has a problem and any part of the pain in the spleen channel, you can select the point which is matching with the spleen area problem, the matching point on the central channel, you can select it. So by extension, you can use it the many way to use this channel theory, or the circadian clock, the meridian theory. Okay, thank you.